Namaste. I'm Dr. Preetha Isloor, consultant in fetal medicine at Apollo Cradle and Children's Hospital. Today I'm going to talk about fetal medicine. Fetal medicine is the branch which helps you connect with your unborn baby. Pregnancy is a joyous occasion to every family as you prepare yourself to welcome a new life into your world. The unborn baby, which is just a mass of few cells, develops into a fully grown, functional being, and it's a fascinating journey. As a fetal medicine consultant, I will be there to look after this baby through your journey of pregnancy. In your pregnancy, you will be referred to a fetal medicine consultant at various occasions. The first one would be at 11 to 13 weeks, where you would be referred to us for a NT scan or a nuchal scan. This first trimester screening is to look for chromosomal abnormalities in the baby. All of us have 23 pairs of chromosomes. Sometimes things can go wrong when the chromosomes are being formed, and such babies can have mental challenges later on. This scan is to detect such babies, and in some cases, if there is any family history of genetic abnormalities, or if there is any previous child in the family with any specific problems, we also screen for those genetic defects in this time. If your screen is negative and you come as a low risk, then next time we meet would be at 18 to 20 weeks. If there is any high risk factor and your chance of chromosomal abnormality increases, then we need to actually test the baby and confirm the chromosomes in the child. This can be done by an invasive procedure called as an amniocentesis. This amniocentesis is usually done in the early second trimester, where we put a very thin needle into the uterine cavity and take the amniotic fluid. So it helps us to either confirm or rule out chromosomal abnormalities, genetic defects in your child. It's a pretty safe procedure, and it's a daycare procedure, and it is done in the outpatient without any additional general anesthesia to the mother. And the tests are definitive. That is, it is 100% confirmatory whether the unborn baby has or does not have a particular problem. The next time we see you would be at 18 to 20 weeks, where we do an anomaly scan. We look at the structural defects in the baby and assess whether all the organ formation is normal in the baby or not. So at certain times there can be major defects, and we may again need to rule out whether this defect is compatible with life, whether it can be treatable or not. A fetal medicine consultant will give you a prognosis and how this disease will fare in the future, so that you can take an informed decision about the future of your child. Growth of the baby forms an important part of the journey of pregnancy. A baby which is growing well will have a potential to survive and have a good immunity against diseases in the future. We also do repeated scans to look at the growth of the baby and assess whether the blood flow to the placenta, the amniotic fluid around the baby, and the baby's weight gain is optimal. Sometimes when the growth is failing, we may also recommend certain interventions and do more frequent scans to optimally time the delivery, so that the baby can receive the best possible chance of neonatal care and the lung maturity is balanced. Certain high-risk situations, such as mother who has diabetes, any systemic disorders, or high blood pressure, or twin gestation, may require more frequent scans and interventions from a fetal medicine consultant. Twin pregnancies can have their own complications, where the growth between the two babies may not be at par. There may be growth lag in one of the babies. There may be blood transfusion happening from one child to another, causing complications in both the babies, in which case a laser intervention may be required to save both the lives. There are other times, such as there may be fetal anemia or there may be infection, which requires us to intervene and help the baby get through to a viable gestation. So to conclude, a fetal medicine consultant is a part of your obstetric care team, which looks after your baby in this fascinating journey of your pregnancy and helps you to bring a healthy life into your world. Thank you.